how do you differentiate between hormonal acne and more typical acne? That's a great question. So more hormonal acne tends to be located along the jawline and around the chin, so the lower half of the face. We think of this as the more androgen or hormonally sensitive areas of the skin, or like a beard distribution is probably the easiest way to envision it. Your traditional acne tends to be a little bit more higher on the cheeks, on the forehead. It can be kind of any way, nodulocystic, papules or pustules, or just blackheads and whiteheads. When it comes to hormonal acne, a lot of times it also flares with hormonal fluctuations. So you'll see in the week or two before menses or before periods, it gets a lot worse, and then it starts to fade afterwards. A lot of times what we like to target in hormonal acne is hormonal regulation, as you probably guessed. So we don't just use our typical medications like retin-A's or retinoids. We use medications that help modulate hormones. Some of those, the topical medications, Winlevi is one of them that is, we think about it kind of like spironolactone, which is a pill, but in a cream version. The other medications that are really good for hormonal acne are on oral contraceptive pills or birth control pills, and spironolactone, which is traditionally a blood pressure medication, but works pretty terribly for blood pressure and has this wonderful side effect of helping regulate hormones, especially for women with hormonal acne. As a patient, you can expect if you're put on a topical cream, it can take anywhere from about 3 to 6 months to really see results. Now, the cream that we use breaks down after about 12 hours, so you really have to use it morning and night to get that consistent response. If you're not using it morning and night, you're not fully treating yourself. With the pill, you can see results as early as 1 month, but usually at about 3 months, we've seen peak effect. So at 3 months, I usually see my patients back just to evaluate how much better have they gotten. If you've gotten better, but you're not at goal, meaning where you want to be, we can increase your dose. If you're doing great with no side effects, we just hold the line and keep everything the same. Hormonal acne, unfortunately for women, we go through periods of acne 3 times in our lives. And I think about those as the first is when we're going through menses for the first time, so menarche. That's when you get your period for the first time. We break out in that peripubertal area. We tend to break out in a lot of acne. The second time is right around childbearing, so a lot of hormonal fluctuation happens around the time that we have kids, whether that's coming off of birth control, whether that's the fluctuations associated with pregnancy itself. Those fluctuations can cause a lot of hormonal acne. And the last is in the menopause phase. We can get hormonal acne yet again. And the beautiful thing about the medications that we have is generally they're safe in both the peripuberty time and the perimenopause time, although we do not want you to take the medication spironolactone if you would like to become pregnant. So if you're in the childbearing zone and ready to become pregnant, that medication is just not for you.